know, with your,
Here. You should have all gotten a little notification. I'm going to stop my screen now. Again, Mayor, I'm listening in on my phone, so if you need anything, just give me a shout out and I will come run.
Great. Thanks a lot, Doug. I appreciate it. All right. Good evening, everyone. Thank you for joining us. I'm Mayor Jim Dunleavy, and I'm accompanied by Councilmember Javon Romney-Rice, and we welcome you to our panel discussion on the COVID vaccine. We want to try and answer as many questions as possible. And we know a lot of people have questions about the vaccine. And we also want to place an emphasis on those questions
We just started a live stream.
from our minority communities here in town. We've assembled a panel of knowledgeable healthcare providers and researchers to answer questions related to the vaccine with an emphasis on those potential concerns, again, of our minority communities. Now, just to share with you a couple of quick numbers. As of yesterday here in New Jersey, over 583,000 first and second doses of the vaccine that were administered here in New Jersey. Only 3% are Black, 5% are Latino. We want to get all our communities here in Teaneck and frankly around the country the best information that we can give in order for them to make an informed decision, because we all need each other in this fight. This is not a singular community issue. So in order to defeat this thing, we need everybody, as I said. Every member of our community, county, state, country, in order to reach that level of herd immunity that will then truly be the safest place for our citizens and our country to be. So Councilmember Rice, do you have a few things to say? And then maybe you can introduce the panel for us, okay?
Sure. Absolutely. Thank you, Mayor. I just want to be brief because I want to leave lots of time for our great panelists that are here with us this evening. And just to state that with the knowledge that Teaneck was going to form this partnership with Holy Name Hospital, and we had a great opportunity to provide a vaccination site here. Early in January, the mayor and I started texting about making sure that there was equitable access to the vaccine, in addition to the need to address the fact that despite Black and Brown communities being disproportionately impacted by the virus, and with that being Black Americans infected 1.4 times more likely than whites, and 3.7 times more likely to be hospitalized and in the ICU due to COVID. With that, we knew that despite there were still many valid reasons why our community was not going to jump at the opportunity to get vaccinated. And I suggested, let's do a webinar and featuring some of you wonderful folks right here. In particular, I want to say Dr. David Diugiud, who early on posted that he got the vaccine and kind of put an appeal out there for the Black and Brown community, which caused me to do some homework. And I was very pleased to be able to jump on conference calls with Dr. Mark Wade and Dr. Mayra Wade, who I've known for many years. And they provided weekly conference calls, sharing information, which was very, very helpful in me making the decision to get vaccinated. So I personally have received both 1 and 2 of the Pfizer vaccine and knew it was very important that we provide an opportunity to educate our community, just so that they would be informed with facts, so that they could be able to make informed, educated decisions about their healthcare. So I'm so grateful this evening that we have with us Dr. Robert Adair, who's a family physician at Holy Name Hospital, graduate of Howard University College of Medicine, having over 50 years of diverse experience, especially in internal medicine, and is very well known here in the Teaneck community and has a practice here. And in fact, Dr. Adair, when I was reaching out to folks to attend tonight, they says, oh, sure, because my doctor is going to be on. So thanks to you, we have a number of folks joining us. Dr. David Diugiud, Doctor of Hematology at New York Presbyterian, Professor of Hematology at Columbia Medical School, dedicated Teaneck resident. I had the pleasure of serving with him for many years on the Board of Education. I don't know how he found the time because he's such a busy doctor, but most importantly, he's dad to Teaneck High School graduates, Jillian and Danielle Diugiud. Dr. Clenton Coleman, who is Chief of Internal Medicine and Chief of Nephrology, Kidney Specialty at Holy Name Medical. He has a practice here in Teaneck, is co-host of Recommended Daily Dose podcast, And he is hosting a similar forum at Holy Name Hospital during Black History Month on the 24th of February, stating COVID's impact on communities of color. We'll talk about that a little bit more later. And we also have another Teaneck graduate, Dr. Kishana Taylor, who is a virologist of Carnegie Mellon University at Pittsburgh. And she is co-founder of Blacks in Microbiology. And her work focuses on the role of the development of severe COVID-19. And she recently participated in a panel discussion in December, resisting the racism of COVID-19. We're happy to have you. And last but not least, we have Drs. Mark and Mayra Wade. Dr. Wade is the director of the Department of Health and Community Wellness for the city of Newark, a city that was very hard hit by the virus. He's an adjunct professor at Rutgers University, School of Public Health, president and CEO of Horizon Walk Ministries Foundation, and president CEO of Wade Healthcare Systems. And he is joined by his lovely wife, Mayra, who is in her own right a dental practice consultant, does dentistry in motion, strategist and planning for dental practices, setup, staffing, management, Pillar College Board of Trustees, and right-hand person to all that Dr. Wade is doing, I know, down there in Newark. And we also have Dr. Minerva Bernadotte, who is a physician at the ER of Holy Name Medical. And I know that she has seen quite a bit over the last few months at Holy Name Hospital. So I want to thank you all so much for taking time out of your busy lives and evenings to join us here and provide valuable medical information to our community of Teaneck.
Great.
And so now we'll be ready to begin with our questions.
Thank you, Javon.
So you want to
do is we'll go back and forth between Javon and I and try and get through as many of the questions that I know that our residents have. So I thought I'd start out with a little bit more of an open-ended question to all of you. And that is, what do you see as the barriers to increasing vaccination in the Black community? What are the things that you see that makes them reticent to perhaps go and get the vaccine? And this is for everybody.
I can start, I guess. Can you hear me? I guess.
Yes.
Yes.
So I think the sad part is the community most impacted by COVID is probably the least likely to get vaccinated. And I think that conversation has a lot to do with health disparities overall. And it's a structural problem from mistrust of the healthcare system, access to healthcare and resources, lack of education, and also lack of providers that look like the community that we serve. So, and then when you talk about the vaccine, those structural factors come into play. So, now we have mistrust of the vaccine. There's lack of education. There's a lot of misinformation about the vaccine. So that's an important barrier. So patients aren't able to make educated decisions about the vaccine. Who's the messenger? Where are they getting this information from? Are they getting it from the internet, or are they getting it from their community doctor that looks like them, that speaks the same language? And also the lack of resources. I think the rollout of the vaccine leaves a lot to be desired. I think it's unfortunate to ask people, different communities, different ages, to actually go on a website. Some people don't have access to computers, to log in, to wait for email, and then now the vaccine has run out. So I think that leaves a lot to be desired. People who are 3 times more likely to get sicker actually should be at the head of the line. We should make it easy for patients to get the vaccine. So that's a complicated answer to a complicated question, but I think there's a lot of stuff that we can impact there.
Yeah, absolutely.
Go ahead.
Now, there are certainly many reasons why the Black community is reticent to get the vaccine, but I think the biggest one is just a general mistrust of the medical community. A lot of my patients, and certainly a lot of my patients at Columbia, I take care of a large population of sickle cell patients who are obviously all Black, and they are more prone to get sick. They are more prone to be hospitalized. They are more prone to die from COVID infection, and yet they are also the most likely to not get the vaccine because they don't want to. Number one is they don't want to trust the doctors that are there. Number two, because they because when you're trying to figure out where your next meal is coming from, you don't really think about getting a shot. And when you're in pain, you certainly don't want to have yet another shot to have to get. So it's a complicated issue, but the bottom line is that people like us really have to reach out to the community to drag them, sometimes kicking and screaming, to get the vaccine, because if they don't, we're all going to suffer for it.
Other comments? I think Dr. Whitley.
Yeah, I like to just add to the comments made by my colleagues here, because they laid an excellent groundwork. This distrust is not just generational; it's gone on for centuries, and for our lives, decades, and it's just as real today as decades ago. So that the experience is a justifiable distrust of the system. And COVID has just put a spotlight on it, if you will. And so as we think about engaging our communities to accept the information that's being provided, as mentioned, it's the messenger, it's the clarity of the message, which is so jumbled up right now, depending on what state you turn on. It's so politicized right now. It's so, there we go again, nobody can tell you. But I think that this opportunity that's provided should not just be about getting our community to take the COVID vaccine, which is the most powerful tool we have in our tool belt right now, besides wearing our masks correctly. But we as the medical community really have to do two things. One, we have to fess up to our history. And even though it's Black and brown members of that medical community, we have to give the clarity and call that, yes, we have not served you well. We've mistreated you, we've abused you, we've inappropriately utilized you in medical experimentation, et cetera. We acknowledge that as a medical community, and our community has not heard that, at least on a consistent basis. Secondly, then, we have to not just voice, but start demonstrating that along with taking the vaccine, that we are doing everything we can to provide the access to care, provide the ability for our community to receive what they deserve beyond a vaccination. Because we vaccinate everybody and we get herd immunity and we won't die from COVID, we've got all these other things that are killing us disproportionately to the rest of the population. So I think it's an opportunity we have to demonstrate integrity, honesty, transparency, and that will go a long way to help our community to begin to trust us. And then, of course, those of us who are in the field have to be willing to be role models in what we say, what we do, and even as we take the vaccine and demonstrate leadership as such.
I think that's why it's so important. This forum right here, the educational part, is so important in the whole process of participation. So I have to just give kudos to the Councilwoman and the Mayor to gather this forum together and help the community get proper information so that they can make the decision to move forward with the vaccination and helping the country heal. So thank you for that.
Yeah, I see it. I'm a doctor of physical therapy and director of rehabilitation services at House Regional down just below you, Dr. Wade, in Elizabeth. And I see it in the staff of our medical center and the reticence on the part of our staff of color not going there. We're still not even getting over that 50% mark of people getting the vaccine, and the stories and the reasons why are unbelievable, and some of it, as you say, are almost purely political, and that's a problem that we're all going to have to overcome, I'm afraid, in a number of areas within healthcare. So, okay, I'm going to turn now. I have two questions I want to give to Dr. Taylor, and then if Javon, if you can take the next few questions. Dr. Taylor,
Sure.
I've had questions related to how the vaccine was developed, and that it was developed so fast, and that they probably skipped a lot of things, and this isn't really a very good vaccine because they didn't check it out. And then the other question along with that is, because of what we know to be the flu vaccine, which is in some cases an attenuated type of the flu, are these people actually getting COVID when they get the vaccine? These are two questions that I hear often.
Yeah. Okay. So I will answer the first question first. mRNA technology has been around for at least a decade. So it just hasn't been used in a mainstream way in this way. So I will say I can speak specifically to the Moderna vaccine, and the Pfizer and Moderna vaccines are very similar, but the Moderna vaccine was originally designed within a lab in the NIH after the original SARS outbreak. And so that was in 2003, so almost 20 years ago at this point. And so it was developed with the original SARS in mind, with the knowledge that a lot of virologists have that we were likely to see another coronavirus pandemic at some point in the future. And so they started to work on this vaccine for the original SARS with the idea that they could then replace the specific proteins for whatever new virus was to arise at that time. And then, therefore, they're already prepared, which is what happened to happen last year. So we got this new SARS-2 virus that popped up. And so essentially what they did was they had this vaccine construct that was already created, and they took the protein from the new SARS-2 virus and popped it in to that vaccine. And that's how they were able to get it into production so quickly. So they had to redo the trials essentially because it was a new protein, but all of the other ingredients within the vaccine had already been tested. And so there was less of a likelihood that it was going to be a big issue because they had actually tested and gone through all of the safety and efficacy studies for SARS-1 to begin with. And so while it seems like it was really, really fast, there was a lot of background research that had already been done. And it's basically a testament to our researchers who kind of have an eye for these sorts of things and are trying to be prepared so that when something like this does happen, we can do things more quickly as opposed to a traditional timeline, which could be anywhere from 3 to 10 years, depending on if their candidates actually work. And then as for your second question, so I'm gonna correct you because I did do flu research before I did SARS research, and most people are not getting an attenuated flu vaccine. If you are getting an injection, you are getting a killed flu virus. It's not live. And so most people do not get the nasal vaccine, which is the attenuated version. So most people are getting the injection. So you're not getting live flu, so you should get your flu shot. But in addition to that, the SARS-2 vaccine is also not a live virus. Essentially, if I can explain it, a virus is like a package. And then within the package is the genetic code for the virus, which allows it to then continue to make more viruses once it infects your cell. And so what scientists have been able to do is make a synthetic version of the genetic material inside of the virus. So the mRNA, it's synthetic mRNA. It's not even actual viral mRNA. And it basically encodes for the protein on the outside of the virus that allows it to enter into the cells. And then so your body is just making specifically that one protein, which is the most important because if a virus can't get into your cell, then it can't replicate. And so it's a synthetic version of the code for the spike protein, which is what people talk about for the most part.
Great.
An important thing to know is that that spike protein allows the virus to get into the cell, but it has nothing to do with the virus replicating itself and eventually making more copies of itself. So you cannot get COVID from the vaccine, period.
Right, you need a bunch of other viral proteins in order to make a new virus. And so you're only getting one of, I want to say like 5 or 6. So you cannot have actual virus replicate inside of you from this vaccine.
Great.
If I could add before we move on, I mean, because wonderfully explained. But not only did we not start from scratch, right, researchers, we have decades of past experience, but a couple of other major things. The first is money. Billions of dollars were poured into this vaccine development globally. And so different than vaccine development heretofore, where, you know, if you have 3 phases, you know, first phase, you get good results. Now you got to find the money to go to the second phase, expand it. Then you have the money to go to the third phase. Governments, private foundations, et cetera, were pouring billions of dollars into this development, and, unlike ever before. And then you had the whole world, scientific and research community, focusing on the same thing. Unprecedented. We've never collaborated like that before. So
Not even close.
The experience that we had previously, and when you have the whole world looking at your development, you can't cheat, okay? Because your peers around the world, including Black and brown researchers and scientists, by the way, okay, who were working on this as well, we wouldn't let you cheat. So no steps were skipped. It was an unprecedented time where money, experience, and global collaboration has allowed us to do what we have never done before. And
yeah, and I will additionally, what usually takes so long in that last phase of assessment is that you have to find cases of the disease to then see whether or not your vaccine is working. Well, fortunately or unfortunately, we have plenty of cases. And so it's been a lot easier to collect that data, whereas like over time for something that's more obscure or that is not in a pandemic at that moment, it takes much longer. And that's usually why the phase 3 trials usually last much, much, much longer.
And you have to remember that this is not normal times, right? So this is an emergency authorization use, an emergency. It's not, you know, normally the process takes years, but this is an emergency. So I think their priority was making sure that it's safe and effective. I think the problem is calling it Operation Warp Speed gave you probably the wrong idea about it, but all the safety measures were taken appropriately.
Excellent. Thank you. Javon, do you want to ask a couple of questions?
You're gonna turn your mute off.
You're muted, Javon.
Javon, you're muted.
Sorry about that. The phrase for 2020 is now 2021. Unmute yourself. I just want to ask, one of the questions that were out here was, if a person has medical conditions, and I know that this is a question that we're referring people to their own medical doctor, their own physician, but are there particular conditions that a person should not take the vaccine?
There are a few.
Anyone can describe
certainly,
that.
If you have had a severe reaction, an anaphylactic reaction, which is a reaction in which basically people pass out, their breathing gets cut off. It is truly a medical emergency. If you've had a severe reaction to another vaccine, you should think long and hard about taking this vaccine. That's what happened to the 2 people in England and the first day that the vaccine was available. If you are, I think if you're in the first part of pregnancy, I think you at least need to consider waiting for a couple of months in order to take the vaccine. There is no evidence that the vaccine causes birth defects. And there's definitely evidence that pregnant women who get the virus get much sicker, much like pregnant women who get the flu get much sicker. Having said that, there were no pregnant women included in the first round of studies. They are being studied now, but that that part just hasn't been looked at yet. I think it's safe certainly for the second and third trimester of pregnancy. The first trimester, I think, is still a gray zone.
And along those lines,
Go ahead, Dr.
go ahead.
I was gonna say there are some participants in those studies who then ended up like getting pregnant accidentally. So you weren't supposed to get pregnant if you were participating in the study.
Yes.
So they haven't seen any ill effects yet, but it still is kind of a gray area. So I think the American College of Gynecologists has suggested that you talk with your doctor before you make a decision if you are pregnant. But I think they're leaning more on like it's a case by case basis, right? I think.
Thank you. So
Yeah.
another question that I have
Dr. Wade?
Yeah, just
is if a person, go ahead.
just a little teeny add on to the allergic reactions. Again, there's a spectrum, right? So when we're talking about severe emergency, severe allergic reaction, we're talking about needing to use an EpiPen, for example. Not you eat blueberries and you get a rash. That's not the type of allergy that we're talking about. So again, it's that which you've experienced in the past has required you to receive medical attention that we are describing as significant allergic history.
Great. Javon?
Thank you. Another question we have is, can I take the vaccine even if I've already had COVID? Would you recommend taking it if you've already had the virus?
Yes, and the short answer is yes. The antibodies that form from COVID we know are short-lived. We don't know exactly how long, but it's certainly less than a year. It may be less than 6 months. And there are cases of people who have gotten COVID a second time. They're rare, fortunately, but it does happen. And so I think it's definitely it would definitely behoove those people to take the vaccine even if they have had COVID.
Go ahead.
Great. And there's a question that people they've heard people get really sick after the second shot. And what are the symptoms and what would be your statement against for people that are concerned that they would get sick after receiving the virus vaccine?
So, I got my second shot, and the first shot I had just some muscle aches and pains at the site of injection. But the second shot, which I took about 3 weeks later, I had a lot of muscle aches and some fatigue. I didn't have any fevers, but those are the main symptoms: muscle aches and pains, fevers, and fatigue. And what I explain to patients is that that means that your immune system is working, your immune system is ramping up, and that's actually a sign that the virus is working well. So that's something to be aware of, and you can treat your symptoms and not worry about any more serious adverse effects after the second dose.
Yeah, I felt like I had the flu for about 12 hours after the second dose. Did not have a fever. My arm hurt like hell, but having I got the shingles vaccine earlier this year. The pain from the shingles vaccine was significantly worse than the pain from either of the shots of the COVID vaccine.
So I got vaccine on a Friday. Felt great. Didn't feel the need. I didn't feel anything. I mean, Saturday I was on a Zoom, but by 12 o'clock I had to go to bed. I ate horrible. But the next morning, I was back in the saddle, ready to go. So I'm saying even most people who have these, again, fever, pain at the injection site, aches, just feeling blah. Most people, almost all people, the symptoms resolve within 24 to 48 hours, 1 to 2 days. So that's for those who get those symptoms. That's about how long it lasts. It's not.
I should say I got the Pfizer vaccine. I don't know about what everyone else here got, but from what I understand, the symptoms from the Moderna vaccine are very similar.
Yeah, and the contrary, because there's another question here. The contrary thing is So if I don't get any symptoms, does that mean the vaccine didn't work?
That means God bless you.
Exactly. Exactly.
Oh, gosh.
I do have a question here that was submitted by one of our residents. I'm a 68-year-old African American. I completed chemotherapy and radiation treatment for stage 1A breast cancer in April. Now that the vaccines are available, are they safe for me? And I have no underlying health conditions. Has there been testing for long-term side effects? Is a three-part question. And since there are now several strains of this virus, are these current vaccines effective against them? So let's take the first one in terms of someone who is under cancer treatment. Would it still be safe for them to be able to get the vaccine?
Absolutely. And in fact, there is very clear-cut evidence, and I say this as an oncologist, that that cancer patients who contract COVID do far worse than does the general public. And also, if this person has finished their chemotherapy, but even if they're in the middle of their chemotherapy, stopping chemotherapy because of COVID infection has markedly deleterious effects on people. That you really, in that setting, I think those patients should be at the head of the line.
And the next part of the question from the same person, has there been testing for long-term side effects?
You want the party line or do you want the real answer?
I think
there's no long-term side effects that we can really talk about with this, because the virus has really only been in existence for a year. So there's just no way we can answer that question with any degree of scientific precision.
That answer is so important. We don't know. Okay,
right.
So
exactly.
Anything else? We don't know, and no one around the globe knows either. So as information comes, then we can validate it. So we're just too early on.
Okay. And then the last part of this person's question is the current vaccines. Do we know if they are at all effective with these new strains that we're reading about that are starting to crop up in different parts of the world?
Yes.
Kishana, you should take that.
Yeah, I was like, yes. So they actually, I know Moderna just released their data maybe yesterday, but basically we are still seeing, so, okay, the best way to explain this is that the whole purpose of you getting a vaccine is for you to produce antibodies that can then fight off the virus. And so what the pharmaceutical companies have been doing is measuring your antibody response post-vaccination. And so they do this by taking your blood and then pulling the antibodies out. And so they've been using antibodies from clinical trial patients to then test whether or not they can still neutralize or remove virus from your system. And so what they're seeing is that while these new variants have the antibodies are have a reduction in their efficacy in removing the virus, it's still way above the level that we need for you to be protected. And so as of right now, you are still protected from these new variants of COVID, but this is kind of an argument, right, for a speedier vaccination process and the continued use of masks and social distancing in order to keep us from developing additional new variants that then would need us to get another vaccine at some point.
Great.
And having said that, coronavirus mutates very rapidly as compared to things like measles yes. And so it's probably not quite as fast as influenza, but I strongly suspect that we're going to need to revaccinate people every few years with this, just because coronaviruses in general mutate rapidly, and also, at least for some of the less severe coronaviruses, people don't develop long-term immunity to them. So I suspect we're going to wind up doing this much like the flu vaccine.
And usually, and the virologist will correct me if I'm wrong, when viruses mutate, they usually mutate to less lethality, right? So they theoretically need their host to be around longer to propagate. Is that right?
Theoretically, but it doesn't always work that way.
Okay.
I mean, if it's doing a good job of getting around while it's also killing people, but they still has a population, then it doesn't really necessarily have that incentive. It really just depends on the population that continues to propagate the virus and what it looks like. But I mean, lethality at this point is 1 to 2%, which is high, but it's not like something like 50%, which would kind of have the virus burn out more quickly.
Yeah. That's actually what happened to SARS-1 and MERS, is that they were so lethal that they burned themselves out.
Oh.
So kind of in
We
summary.
certainly want to make sure that we give Dr.
Yeah. Sorry. You go.
Go ahead, Dr. Wade.
Just.
No, I was just gonna, you go ahead and with your summary.
No, I was just going to say just.
And then I want to just give our other lady to chime in.
Absolutely. So just in summary, the current vaccines, Pfizer and Moderna, there's a medical agreement globally that they work against the variants, okay? And the more people who take them, the less chance we'll give coronavirus an opportunity to mutate, okay? So it's a race against time. So the more they get vaccinated, the better off we'll be as a global community.
Javon?
Great. Thank you. Yes, I just wanted to make sure that we gave Dr. Adair and Dr. Mervine an opportunity to chime in. And one of the questions I had, Dr. Adair, since you do have so many patients in the community, have you had your patients asking you specific questions about interactions with their medications and whether they should take it or not? And just wanted to have you an opportunity to chime in.
Okay, well, I think the first thing I should say is that for the last 2 weeks, every patient, no matter what their ethnic, religion, country of origin, so on and so on, has asked me, should I take the virus?
Should I take the
vaccine for the virus. So I think this is on people's mind. And I think that this webinar tonight goes a long way to helping them understand and feel comfortable. As an old public health person with an MPH from Columbia, I think we have reaped the benefit or the lack of comprehensive public health service, which unfortunately was dismantled over the last 50 years for a number of reasons. But now that the virus is sort of, or virology has reinvented itself with this whole new class of viruses, we're going to have to think about that long-term in the future. But I think the message that we as a group of health professionals should be sending to our patients is one of trust. This is all we have. We've all had the vaccine. Yes, there are areas that we don't know what the future will bring, which are long-term side effects. But in terms of you today, your health and your future survival versus not taking the vaccine, anyone that would ask me, unless they have very severe health problems, should take the vaccine. Me as a Black man, a Black physician who's been practicing for over 50 years, you should take the vaccine. This is all that we have. And we as minority, people of color who have higher rates of diseases and also susceptibility, we need to take the vaccine.
Just to piggyback
Thank you,
on
Dr.
Dr.
Adair. That was, please, Mervine.
Go ahead.
No, just to expound on the wonderful points everyone has made, I think the issue with coronavirus and also now the vaccine is that this has been politicized from the very beginning. Even the issue of whether or not we should wear masks has become more of a political issue than anything else. So it's hard for the community to trust the messages that's being told to them. I would say, I was hesitant to take the vaccine, to be quite honest myself, just out of a concern for more of a long-term side effects. I was had some mild chills and fevers and body aches for about 24 hours, and then it all went away and I was much better. I think we need to get that message across to the community. We know the side effects of COVID. We know the long-term side effects with respiratory illnesses, with stroke and blood clots in the lungs that are killing our community. So I think we need to get it across that the 24-hour illness that you may have from the vaccine pales by far in comparison to contracting COVID. And I think that message just needs to be made very clear with a lot of education forums like this.
And I can certainly tell you, I was equally skeptical in terms of whether we should take the vaccine, because I don't trust anything that 45 says, period. But for that reason, I actually went, and when the FDA's data hit their website, I went and reviewed the data for both Pfizer and Moderna. I haven't done it for the others that are out there because they haven't shown up yet. But the data for this in terms of safety for this vaccine is better than any that I have ever seen, including the flu vaccine that we give to everybody every year, or try to give to everybody every year. And the efficacy is probably at least as effective as, and in most cases more effective than anything except maybe the measles vaccine. So from my point of view, unless you, you know, like I said, I wouldn't believe anything that 45 said about pretty much anything, but in this particular case, this vaccine is effective, it's safe, and the risk of getting COVID and becoming dangerously ill for it, especially for someone like me who is a 66-year-old overweight diabetic African-American healthcare worker. I don't like saying all those things in one sentence, but the risk of my getting COVID far outweighed the risk of the vaccine.
Can I be controversial for a minute?
Thank you, Dr.
Sure.
So I
Please.
think our audience and our patients have to do their due diligence when educating themselves. Like
Yes.
we, primary care providers, encounter this every year when talking about the flu vaccine, but I have no difficulty giving a patient a medication for their erectile dysfunction or their weight loss. They're not looking up the data or the research when it comes to that. So I think we have to hold ourselves accountable to and prioritize things that we want to prioritize. So this is a life or death situation. We can spend money and time researching a new TV at Best Buy, but we can't do the research and the due diligence when it comes to doing something to protect our lives and our spouses and our loved ones. So that was my controversial
we're not
statement.
concerned about the medical side effects of medical marijuana, but
Right.
you know, because that's something we want or something we think we want. So, you know, again, it's human nature. If you want pretty toes, you'll spend a lot of money to get your toes done. But to go get a chest x-ray or go get colon cancer screening, that ain't important. So again, I agree and also echo what Dr. Coleman has said. You know, personal responsibility in the end is, we can talk all we want, but everybody talks about they know their body and it's their body. So your responsibility is to yourself. So you owe it to yourself to educate yourself and be aware of what needs to be done to stay alive. The other thing is that, you know, when we doctors are in the hospitals every day or in the ICU, and you walk in the ICU and you see 40, 50 people intubated, and you know that within the next 5 days, 35, 37 of those 40 people will be dead, that is a wake-up call. And this vaccine will keep you from ever having to experience that. So this virus will kill you.
One other thing that I would like to say, and that is that this is also somewhat controversial, but you know, we've had a lot of people at a lot of people at our institution who have skeptical about this, who have said, I'm not taking that for, some of them are concerned about infertility. Some of them are concerned about a host of other issues. The problem right now that a lot is that, these are all healthcare professionals that we're talking about in various and sundry stages. They have had first crack at the vaccine, and appropriately so. But there's clearly a shortage, and what is going to happen, I think, is that if you pass it by and all of a sudden 2 months from now you decide it's time for you to get it, you may be screwed because we need to get to herd immunity, period, end of discussion. And if we get there by vaccinating everybody in our community, wonderful. And if we get there by vaccinating everybody in somebody else's community, wonderful too. But those people who passed it by may be out of luck.
Yeah, I think I'm seeing a similar thing now, where in my facility, a number of people are now okay, everybody on my floor, in my floor staff has now got it and they haven't died. So now maybe I'll get it. But now we have what you said, Dr. Diugiud, and that is, well, but we don't have the availability of the vaccine. So we have to be very, very judicious in how we use it until we get a full flow. Yeah, I see that as well.
Mm-hmm.
And Dr. Coleman, that's not controversial. That's real talk. So we are introducing, our community. We have a responsibility ourselves, and look, herd immunity, meaning enough people are vaccinated so that the virus will find it difficult to find somebody else to infect. We got an option. Either we get to herd immunity by vaccination, or we get to herd immunity because 70 to 80% of our community becomes infected. And we see how that's going, right? We see. So it's not a question of if, it's just how. And we're recommending that we do it the safest way, which is through prevention, through vaccination.
This has been fabulous. And I know that we could probably continue for a whole nother hour, but we don't want to commit your time any further than to an hour. And so we have about 10 minutes left. And I really would like to give an opportunity for you to just make some closing statements for this evening that you would like to share.
I'll go. Okay. So I was going to say this earlier, but a lot of people who I've had conversations with have expressed the desire to sort of treat or fend off COVID naturally through healthier diets and those sorts of things. And I always tell them that, yes, a healthy diet can absolutely prepare your body to be better at fending off infection. But we have had healthy diets or fruits and vegetables and herbs and all of things have been available to us for hundreds of thousands of years, and we still continually get infected with viruses. And so while it might make you feel better, it might treat some of your symptoms, it's not going to stop the virus from replicating in your body. And the best way to do that is through vaccination. And so a combination of vaccination and healthy diet and herbs and all of those things that you want to do, I think are great. But I don't think that's not, there is no evidence that that is going to be enough in and of itself to help you get through a case of COVID-19. And so I think it's really important to do both. And as someone who's interested or who researches viral evolution and the work that goes into developing a vaccine, this is probably one of the most clean vaccines you can get. It's not being produced in eggs like flu or some of the other vaccines. It's literally just some RNA and then the lipid that is then delivering the RNA. And so in terms of in terms of safety, in terms of what you're putting into your body, I think this is probably one of the better technologies, and we will likely see more mRNA vaccines in the future. And so this is definitely something that you should get your mind wrapped around, because should there be another pandemic, and there likely will, this might be the same technology that we're using again. And so it's time to start wrapping your brain around and getting used to this idea.
Anyone else?
I would say, just make sure you empower yourselves and educate yourselves. Make sure you're getting good, appropriate, correct information from the right person. You don't ask your banker for car advice. You know, you ask your doctor for, or your nurse or your healthcare provider for medical advice. So, you know, we have an open door policy. I'm sure Dr. Adair and all the other doctors here, as far as, you know, you can Google my name find my telephone number and call me. I'm sure everyone else is as available, because I think we need to get the message, the truth out, the clear message out to people, and that will provide them with the resources they need to make the appropriate decision.
Yeah, absolutely. And I live here in Teaneck. I'm listed in the phone directory. I always have been, and I'm more than happy to answer anyone's questions, particularly for those people who have pre-existing health conditions. You know, there are some people who get COVID and don't get sick from it. And they find out several months later that they've now got antibodies. And for that person, that's great for them. But in many ways, you're playing Russian roulette with that, especially now that we have a way to prevent your getting sick from it.
Yeah, I would say the same. I would say to, as Dr. Coleman has already said, to make sure that you educate yourself, ask questions, but get vaccinated, but also continue to wear your mask and wear it properly over the nose and over the mouth.
I can only echo what everyone has said. I think that, you know, we have experts, we have people that are very knowledgeable here and that have been on this webinar, but personal responsibility is still your responsibility. Just make sure that when you are doing your research and you are asking and getting information, that you make sure that it's coming from reputable sources. So, you know, there's just so much propaganda out here, so much disinformation. And in the end, a decision like this comes down to trust. And I think that was the primary reason we have this webinar tonight. You know, we have people here, we've had the vaccine. We know what we're talking about. We represent you. We want you to be safe. And again, if you ask me, should you take the vaccine? If you put all of the cons against all of the pros, the answer is yes.
And I think I would just conclude with everything mentioned by my colleagues, right on time, right on point. But you know, those of us that are on this webinar and in our community who have chosen healthcare, we've chosen it because we love you. Okay, we really love our community. We love the patients that we take care of. We care about you. And so we are doing this because of our commitment to you. You know, I'm a preacher as well. You know, it's a good Bible line that says, you know, whose report will you believe? Everybody is believing somebody. So the question is, where are you choosing to lodge your faith, if you will, in the message that's being shared? And we're encouraging you to lodge it, not just in us as individual, but in the medical literature. Look up whatever institution or individual you trust, NIH, CDC, World Health Organization, whichever one will give you comfort. And we can assure you that you'll see the same message that we're sharing here. And we need a collective response from our community, individually and collectively. And we know that we'll overcome this one as well. So we just want to thank you for trusting us with the information we're sharing.
I am going to end by encouraging everyone who is on this, who's seeing this video, to pick up the phone tomorrow morning, go and make your appointment to get your vaccination. Go online, get whatever information you need so that you can register and get your vaccine. Good luck to everyone. God bless.
And keep at it. I know the websites are difficult under the best of circumstances. If you are older and you have problems navigating computers, or even if you're younger and have problems navigating computers, find a friend to help you get through it. This is important. You really do need to do this.
Well, I want to thank you all. This has been just terrific information. I wish I had a way to get the other 41,998 residents in my town to hear this. We're going to be putting this up on our website because it is being recorded so people can access it. And we also have a YouTube channel where it can be accessed as well. I want to thank Doug Roussillon and Luis DePaz from Township staff who helped us put this together. And I just want to mention that as everyone knows, the township has partnered with Holy Name Medical Center to create a pod, as they call it, or point of distribution at our Rhoda Center. I know there has been some frustrations with the registration process, but I can tell you from the emails that I've gotten, and quite frankly, in one instance, the tears of joy of a woman who got a vaccine when I met her at the pod, that it's running very, very well, but we're all up against it in terms of when will we get the vaccine and how much vaccine will we have? And we don't want to set up any appointments for people only to have to turn around and call them off because of it. So we're trying to do it as expeditiously as we can, respecting people's time. I know Dr. Diugiud knows from being at New York Presby, they had a little issue with having to cancel several thousand, I believe, along with Mount Sinai for that very reason. And we want to try to avoid that. So I'm just asking the public to be patient. We're here for you. And I think we're the only one in the state that has partnered with the medical center to do this with township local government. So kudos to our manager, Dean Kaczynski, as well. So Javon, do you have any last words?
Yes, just, the fact that this information was shared so honestly and transparently, and we will continue to share this. I've had people texting me the entire evening about how well this has been done, the great information, how can I get my vaccine? People who have been asking me questions. And I say, please tune in and get information from the doctors. And Dr. Adair, you mentioned the trust factor. I wanted to make sure that people could see people from our local community, people who I know I can always trust for real information. And I couldn't have asked for more truth to be demonstrated tonight. And as was shared, please continue, don't give up. We have access right here in our community to get the vaccine. And I have had people calling me saying, they're concerned that they haven't seen a good representation, particularly in people of color that have currently been there. And Dr. Diugiud mentioned earlier, with herd immunity, we're just concerned that it won't just be one portion of one selection of a particular minority group that is not vaccinated. So out of that herd immunity. So we want to make sure that everyone has equitable access to information and indeed equitable access to the vaccine should they decide to get it. So thank you guys ever so much for all the information that was shared. Thank you for making yourselves available beyond tonight, offering your contact information, Google you. And I know you were all very, very busy. And I just like to say for people that are looking for good medical care, you don't have to look very far. They're right here. And Kishana, who is a proud Teaneck graduate, we are so proud. I looked you up and Googled a lot of your information, very excited for all the things that you were doing and setting a precedent for our Teaneck High School future medical folks in the field in STEM. And David Diugiud, one of his daughters, also a physician. So we're being well represented. Thank you guys ever so much. Greatly, greatly appreciated. This was a wonderful evening. And we may call on you again because should we have the opportunity to share this again, I hope you would still be available.
Javon, can we just thank you? We want to thank you and thank you, Mayor, for your vision for doing this. And I just need to, as the one whose primary work is not in the Teaneck area, but in Newark, I have to give a shout out to my mayor, Mayor Rosber Rocca, who's leading the charge there and doing a fantastic job. So couldn't let the evening go without.
Yes.
Yes.
Thank you so much.
Absolutely. And
I want to leave everybody with this. When you wear a mask, it was mentioned earlier,
Over
It
your
goes
nose,
up over your nose.
please.
Breathe. Goes up over your nose and under your chin.
Yes.
Keep socially distant.
Yes.
Please get the vaccine. We're here for you. Thank you all, everyone. I'm indebted to you. Have a great
Thank
evening.
you
Thank
all.
you.
Good night.
Good
Good night.
Good night.
Good night. Thank you.